Minister of Health, Honorable Dr. Frank Anthony, in a recent interview, shed some light on the COVID-19 situation in Guyana, expanded testing, a review of emergency measures, and considerations for self-quarantine and isolation were among some of the matters addressed to better contain the situation.
In light of the COVID-19 pandemic, mass testing will be rolled out in all regions. Newly appointed Minister of Health, Honorable Dr. Frank Anthony, on the Government in Focus program, explained that due to limited testing being done, there is a false sense of security among Guyanese that COVID-19 is going away.
We have streamlined the laboratory to ensure that we can do more testing, and we have placed more kits, testing kits, in the various regions. So what we actually have been doing over the last couple of days is testing more people. And as you do more tests, you're going to find more people that are positives. This disease, it's not only, you would find people who are positive not and who does not have any symptoms. And that's one of the things that we are now discovering. There are quite a few people who have been walking around quite comfortably, not coughing, don't have any fever, none of the typical or classical symptoms of COVID-19. But when you do the PCR testing, we are finding that they're negative. And this is something that we've seen around the world, and we are seeing that here in Guyana as well. So I think as we ramp up testing, we should expect that we'll be getting far more cases. And for those regions that was showing negative all along, so for example, in Region 6, we only have one person who was confirmed with PCR testing. And that has been the only result for Region 6. That does not mean that Region 6 perhaps do not have other cases. So when we start doing more testing in Region 6, we'll probably see that there are cases now in Region 6. Similarly, I think in Region 5, once we start ramping up testing for Region 5, we will be seeing cases in Region 5. Already, as we are doing some tests in Region 2, we are now seeing persons who are positive in Region 2. So I would say that people have to understand the epidemiology of the disease, and that no region is immune because people have been traveling from one place to another, and if they do that, there are possibility that the infection would be in those regions.
Moreover, increased attention will be given to regions that have had an alarming number of positive cases within the last few weeks.
We have some regions where we have seen some spikes in cases, and these regions would be Region 9, Region 7, and Region 8. And we have taken measures to contain the amount of cases that we have there. Region 9, I guess there's a mixture of things happening there because, in the neighboring, our neighboring country, Brazil, Brazil would be having on a daily basis perhaps about 50,000 or more cases per day. And in the state of Roraima, the incidence of COVID is quite high. While we have closed the border crossing, there's still a lot of people who are going across Brazil because our borders are not properly policed. And it's going to be extremely difficult to police that long border. So there are people who are crossing back and forth, and we suspect that a number of persons who have gone over to Brazil and have come back over to Guyana might be the ones who are bringing across the infection. We have started a massive education program in the region, trying to talk to different persons who can influence the citizens in the various villages. So like Tushaus and so forth, we are involving them in a program to help with the education. And we also have programs on the radio to try to help to lift awareness and education about the reasons why you need to stay at home, help us to curtail the spread, and so forth.
In response to the situation in Region 9 as well as Region 7, medical teams from Region 4 has been dispatched to lend support.
We have had a special challenge with Region 9, and that is some of our medical staff. Uh, One of the doctors who were working there, he got infected, and because he was in close proximity with some of our other medical personnel, we have quarantined the whole team. And because we have quarantined that team, we had to send replacement out of Georgetown. So we have another team of doctors that we have sent in, and nurses and other public health professionals to make sure that we do not compromise the services that are being offered in Region 9. So we have literally a new team, while that team that was there before, they are in quarantine at the moment. Once they become negative, they'll be back on the job. Similarly, we have a situation at the Bartica Hospital where some of the medical personnel who were working with COVID patient, they got infected. And so that team, we have now sent a new team that would be going in on Saturday. They're right now getting a briefing, and they will be joining the colleagues who are not infected so that we can keep the services at the Bartica Hospital up and running, and to make sure that we do not compromise healthcare in that area.
The Ministry of Health, under the guidance of Minister Anthony, has adopted a proactive approach in response to COVID 19 in an effort to better manage the situation in Guyana. This involves regional and international stakeholders making a challenging task easier through collaborative measures. Notwithstanding the significant impact that COVID 19 has had on the lives of Guyanese, thus far, Minister Anthony said his ministry is currently weighing options to allow persons to self quarantine or self isolate. Noting that these strategies will be put in place to allow citizens to be cared for in the comfort of their homes, Minister Anthony highlighted that compliance by the general public is essential in moving forward to help curb the spread of the novel coronavirus.
One of the concepts that we are trying to work on is to see whether or not we can do home quarantine, and if we can do home isolation or self-isolation. But there are people who, when you offer, so what we want to do is to offer two things. We can have self-isolation, self-quarantine, and we can have institutional quarantine and institutional isolation. Now, there are people who we are trying to work with, but when you put them in self-quarantine or self-isolation, they're breaching the rules, because self-quarantine means that you have to be home, locked away in a room and not in contact with the other family members, so that you're separate, and you don't, if there, you have the infection, you don't spread to anybody else in the home, and that you're staying home and not going out on the road and mingling with the general public. Unfortunately, we've had cases where people were placed in self-quarantine and self-isolation, and they have breached those rules. And when that happened, people then start seeing that we should be moving people, not giving them this option of self-quarantine and self-isolation, but we should be moving all such cases into the institutions, right? But we still want to have people in this self-quarantine and self-isolation if they are going to comply with the rules. And that is something, when the team come out, they will make an assessment of the person's home to see whether they meet some minimum conditions for self-quarantine or self-isolation, as the case might be. And if they do, to also work with them to explain to them our expectations.
The health minister explained that his ministry is also seeking to improve the conditions at those active institutional quarantine and isolation facilities. On another important note, there will be the review of the emergency measures with the aim of garnering public compliance.
Indeed, there is a plan that has phased reopening, but those phases are dependent on the epidemiological picture that you have and the data that you're collecting. What do I mean by that? If you have an increase in cases, then perhaps you need to evaluate to see whether you can go forward with the next stage of opening, or you have to stay where you are. And that's an important thing because, not just because 2 months ago we have had a plan and we determined phases, that means that automatically you move from, once you meet whatever time frame, that you move from this period to that period. You have to work with the science. And if you're getting more cases, then we have to evaluate to see whether or not that reopening is possible. So as it is, the current order expires on the 15th, and we have a team, both public health and legal team, that have been engaged in reviewing the current order. And very shortly, there will be another one gazetted. And there would be certain measures in the next order. One of the things that we want, there are a couple of things that I think we want to emphasize, that if people, this thing here is not a government thing alone. This disease is affecting people, and it depends on people's behavior. If you do not subscribe to the rules that are in place, especially those for prevention, we are going to have an increase in spread. It's a very simple thing. One, we see too much clustering of people all over the place, not abiding by the social distancing rule. Now, we can have the best rules in place, the best pieces of legislation in place, but ultimately it depends on people, because you can't have a policeman at every citizen door, right, to see that they're doing the right thing. So people have to understand that if you do the right thing, you would be protected, your family would be protected, and the general public would be protected. We don't want to stifle the economy. So that balance that you're talking about is that we need to balance the public health measures with what we are going to do to help people get back on their feet. But one of the quickest way of doing that is to work with various sectors to develop protocols. And once we have those protocols and guidelines and they can be properly put in place and being enforced, then we'll have no problems with opening up some of these sectors, because, but again, it comes back to following some of the rules.
Dr. Anthony also responded to claims by the previous APNU AFC coalition administration that COVID-19 cases were underreported due to politics.
It's obvious that my predecessor didn't know what she was doing, because from a technical medical standpoint, they have really mismanaged what ought to be done. We don't have the necessary supplies. We didn't have the capacity at the laboratory. I don't think she understood the importance of testing and why you need to test, didn't put the mechanisms in place to ensure that testing was done. And therefore, if you're not testing, you're not going to find anything, right? So whatever advice apparently that was given by the technical people to her, either she failed to understand the advice and did not implement it, or if she did understood the advice, well, I don't understand why it wasn't implemented. But what we inherited was a mess, an absolute mess. And that is what we've been spending the last couple of days trying to fix. So in terms of laboratory capacity, ability to do more testing, getting supplies in, these are the things that we have been engaged in almost on a daily basis. In terms of the teams and responsiveness of teams, and deploying people and so forth. These are the kind of other ways that we have to respond. And we have been putting, the kinds of mechanism to be able to do more rapid response. So she might be right that the politics has interfered, but the only politics that would have interfered is that within their government, you had a top-heavy task force that was made up of the cabinet, and the cabinet, I don't think, had a lot of medical technical people. So literally, you had a bunch of people who did not understand anything relating to the epidemiology and dynamics of COVID running a pandemic situation.
To help curb the spread of the novel coronavirus that has taken lives across the world and right here in Guyana, Minister Anthony has reiterated a call for Guyanese to act responsibly to ensure they do not contract the disease. The virus, he notes, is one that will be around for a while, so for the safety of all persons, they must adhere to measures and take the necessary precautions.